Carter for 5 minutes.
Thank you, Mr. Chairman, and thank all of y'all for being here. As a healthcare provider for many years, I can tell you this is extremely important and of concern to all healthcare providers for a number of reasons, not the least of which are the penalties involved with HIPAA and everything else that we are acutely aware of. Let me ask you, Mr. Sulak, you're the co-chair of the Healthcare Industry Task Force, and that task force has the charge of coordinating industry and the government side to cooperate with and secure digital networks. Is that correct?
Well, we had a task to analyze the challenges and create the report for action. It was, again, a one-year limited version of a task force to come up with these recommendations, and is not necessarily an ongoing activity under the current legislation. Okay, well, can you describe for me your experiences when you first heard about the WannaCry attack and your interaction with industry? Can you walk me through that? Yeah, I think when we looked from a task force perspective on the challenges there, what we really see is the task force identified and repeat that industry and government need to work together about promoting and promulgating best practices in cybersecurity. And really, I think when you look at the recommendations that came out of WannaCry, the action items that came out of WannaCry, they clearly line up with the task force recommendations of focusing on those best practices. How do we roll those out? Making sure that we have good cyber hygiene on our computers. So, I think the recommendations around WannaCry really do line up and successfully match to the task force recommendations. Can you give me an idea about the quality of the devices that hospitals are using now? Are they pretty well prepared, or the healthcare facilities, they've used a lot of these devices for many years. Are they up to date? Are they prepared? Do we need? I think the task force members really said they run the gamut. We've got some organizations which are using state-of-the-art information, but there's a lot of large technology like X-ray machines and other large big bill items that really are legacy applications, legacy systems, legacy operating systems, which are a challenge. So I think, when you look at the task force report, it looks at some of those challenges. It was like, look, we need to do a better job developing new stuff, secure operating systems do that. But we also have to look at architecture and security design issues around how do we segment these systems which are older. We still need to operate on them. Small organizations may not be able to, really easily replace a scanner. How do we help them segment that stuff so it becomes less risky? Do you feel like we're making progress? I think I think we are making progress. I think if you look at the task force report, they really see this as a goal that industry recognizes and can embrace about, coming up with better best practices for this. So they were very confident that, this is an area where industry really can be a leader in this area. And I think, what we're doing is we're seeing progress in there, but obviously there's a lot of room to grow. Good. Mr. Scanlon, very quickly, you're Deputy Chief Information Security Officer at DHS and the HHS designee for cybersecurity. One of the things in the cyber threat preparedness report, it identified a number of findings, including the fact that there are 11 components within the department that contribute to the healthcare sector threat preparedness. But a consistent concern that we found in preparing for this hearing was that there's a confusion out there about who to call and with some of the outside groups. What are we doing about this to try to clear that up?
Well, sir, step one, and we acutely are aware of that internally ourselves. I would like to say, though, on the one hand, there is an advantage to this large array of organizations, is that we have a 360-degree view of the sector. So internally, our intention is to be able to get that view as a single view that can go out and provide a 311 capability in. This is what the Cybersecurity Working Group is primarily tasked with doing. That is, of course, takes work, that takes time, but we are underway at doing that. We're going to be looking to you for support in that effort as it goes forward, but that is exactly the problem that we intend to solve, and we saw that very clearly in the WannaCry event. We have solid proof of why that needs to be addressed, and we think we have a path forward to do it.
Great. Well, I'm out of time, and I yield back.
Thank you. Now recognize Ms. Walters for 5 minutes.